And action. Anna had a question about polycystic ovarian syndrome, and I did do a tutorial in the past on PCOS, but truthfully it was a little bit dry, and I wanted to see if I could talk about it in a more descriptive term so it's easier to follow. The concept is tough. It used to be called Stein-Leventhal syndrome back in the 80s, but they found a couple of other possibilities of why it happens, and they labeled it as just PCOS. But either way, hopefully this will make it a little easier to understand. So usually what happens in a female is that this is the uterus and these are the ovaries. The brain stimulates the ovaries to get ready for ovulation and possibly having a child. That means the one ovary every month has to produce a little ovum or egg, and that egg has to be launched from the ovary into the fallopian tube to meet hopefully with sperm somewhere in the uterus and implant. When the sperm and ovary, which is essentially an embryo at that point, implant or get ready for growing, the uterus sends a message back to the ovary, and it changes a whole bunch of things getting ready for 9 months. The uterus also sends a message to the brain, again supporting the possibility of potentially supporting a baby for 9 months. So that's the feedback loop that's supposed to happen. Unfortunately, with PCOS, or polycystic ovarian syndrome, sometimes what happens is the brain, which secretes luteinizing hormone, or LH, pituitary in particular, makes a little bit too much luteinizing hormone. And when it does, already the feedback loop is screwed up because it overstimulates the ovary to make way too many ovum. Now you can make 1 egg a month. When you make a whole bunch of eggs in a month from both of the ovaries, that's painful. Imagine having a pimple on your nose, very sensitive. Imagine having a ton of pimples on your nose, on the inside, on the outside. Even just touching your nose slightly will be very painful because the nose is swollen, it's inflamed, it's painful. So that's what happens with the ovaries. They don't produce viable eggs, they just produce a whole bunch of cysts. And with a lot of cysts, you'll have pain. With one of these cysts leaking blood into the abdominal cavity, that will be painful too, especially that time of the month. So the periods will be off, the periods will be delayed, there'll be infertility, very painful. So what also causes or can attribute to the ovaries producing too much egg would be if the insulin from the pancreas is overproduced. That's the other theory. So this is the pancreas. It's a little gland that's supposed to produce insulin. Usually if you eat a meal, if the meal is heavy with carbohydrates, which it shouldn't be, it should be mild, but if it's heavy with carbohydrates, the pancreas produces a lot of insulin so that the carbohydrates and the insulin work together to get into the cell and out of the bloodstream. Too much sugar is irritating to the bloodstream, so if insulin is around, it takes it into the cell and it tucks it away and saves the blood vessels, saves the heart. But sometimes the insulin will be overproduced by the pancreas, and what does that do? It also tells the ovary to make a lot of androgen, or hormone. And that's what usually happens is, to make all this stuff, you have to make excessive amounts of hormone. The one particular hormone that causes problems with PCOS is androgen. Yes, androgen is usually the primary hormone in a man, but it can be made in a woman. And when it's made too much in a woman to overpower the estrogen and progesterone that women make, it usually leads to hair, excessive facial hair. It leads to acne because of the androgen secretion. It leads to female pattern baldness, and it leads to diabetes because of the non-responsiveness of the insulin. So when androgen is increased, when insulin is increased, whether it's the primary source or because of the androgen being increased, it can lead to all these problems. And when it leads to these problems, you gain weight, you have all those symptoms of the acne and the male pattern baldness or female pattern baldness and the facial hair. And then you have unresponsiveness to insulin, because it's a tough feedback loop to demonstrate or to describe, but when there's a lot of sugar, say for a diabetic, when there's a lot of sugar in diabetes, the pancreas tries to match all that sugar that you eat with massive amounts of insulin. And it tries to protect the blood vessels. But unfortunately, sometimes what happens is with all that insulin around, the cells actually become insulin resistant. They don't listen to the insulin anymore, which is a weird thing that happens. But when you're insulin resistant, Pancreas has to actually to produce more insulin to protect the blood vessels from all the sugar that people are eating. So you can see how one feedback loop gets worse and worse. Well, same thing can happen even if it's all initiated by either overproduction of insulin or overproduction of this hormone from the brain. The ovaries still overproduce, and they cause a little bit too many side effects with the androgens, and then that insulin becomes a secondary component that leads to obesity. And that's where obesity, weight gain, can lead to high cholesterol, lead to high blood pressure, lead to that pre-diabetes or diabetes state. And that actually will lead to the brain producing way too many hormones and the insulin being more and more, I guess, secreted, but body being resistant. So it's a terrible feedback loop. And it's difficult to assume where it starts, but the studies have used to be that there is just no talk between the uterus and the ovaries. Now there's this concept of the LH or the insulin, but whatever the reason, we now have a problem with obesity, with the hair, the acne, and the essentially infertility that happens. And usually what happens is with all these things going on, you'll have somebody that develops a lot of weight right in the center. So centripetal weight distribution, skinny arms, skinny legs, big belly. So that's very tough to deal with. I think that if the ovaries are off, that's why I also drew these things. When the ovaries are off, the thyroid's also off. And the adrenals on top of the kidneys here are also off. I think all three glands, thyroid, adrenals, and ovaries, all work together. So when one system is failing, the others have to pick up the balance of the body. And they eventually fail because you're not supposed to overtax one or all three. So I usually find that when there's problems with cysts in the ovary, there's usually going to be problems with cysts in the thyroid, like a Hashimoto's. Hashimoto's thyroiditis, check out my video, DrRic Tutorial Iodine and Thyroid, and you'll understand about what usually happens. In fact, what I usually do when I treat a underactive thyroid, if it's because of not enough iodine being in the body, which I think a lot of it is, when I treat people with iodine for the thyroid, cysts go down and size decreases in the thyroid, but lo and behold, usually those PCOS sufferers get less cysts in the ovary, as I've been told by my OB-GYNs when I send them back to the OB-GYN for their workup. No more cysts. So I think there's a coincidence. No more cysts in the ovaries, no more cysts in the thyroid, and lo and behold, again, the acne goes away, that cystic acne goes away. So when one system or one gland is off, I still have to pay attention to the other glands. And I think an endocrinologist can do that, or an OB-GYN that practices endocrinology, reproductive endocrinology can do that. But I just see that sometimes the specialties don't talk to each other, or they don't talk to me. So I think that one of the things that you can do to control all of these problems is you can put a Band-Aid on the acne with spironolactone. Spironolactone is a water pill. It used to be a water pill. Now I think most doctors exclusively use it for its other benefits of decreasing androgen production. So it does help with lowering facial hair and acne, but you will be on that forever. What sometimes happens is if you can control the way the ovaries develop any ovum at all or cysts at all, then that would be, again, a Band-Aid that cuts this before it even starts. That's birth control. Some people don't like birth control because of the potential for breast cancer and other things, but it does help, especially if you're in dire need of taking care of weight and facial hair and pain, or if you want to be fertile and have a child, especially if you're in reproductive age. Birth control and or using certain androgen blocking hormones can help with producing eggs properly and not too many at a time. So that's with reproductive endocrinology. Something I think the medicine that used to be termed as clomiphene, but there's other forms of it nowadays. So sometimes if you're expecting that you're going to have excessive amounts of insulin, then you decrease the reason for insulin to be produced, which is usually a low glycemic index diet. It's hard to maintain a low glycemic index diet even for diabetics, but definitely with PCOS sufferers, and again, PCOS usually leads to diabetes anyway, you might want to be seeing a nutritionist and practicing that kind of a diet. I've done videos on the low glycemic index, you might want to check that out. It's usually increasing your fiber, increasing your vegetables, increasing your protein, increasing your healthy fats. If you can decrease your carbohydrates, again, that's what we want to do. Healthy carbs. Working on obesity, exercise, mindful practice, and lowering cholesterol, always important because it's the end result, but taking care of the cause of the problem is the most important thing. If there are problems inherited with ovaries or uterus, you always have to have a pap smear done. Sometimes you can detect it with an ultrasound. The tests can be for checking blood tests for excessive amounts of LH to FSH, that's one hormone, or looking for insulin levels, looking for testosterone levels, or the ultrasound like I talked about. You can never forget doing a full thyroid panel, and I think in a cortisol and a DHEA workup, the adrenals will be important. But it all depends on your doctor. So that, in a nutshell, is the way I would present a treatment plan for polycystic ovarian syndrome. Having somebody design exercise, because when you're overweight and you just do an exercise routine, you can injure those knees. You can't cause pain in the back, so you have to have somebody design an exercise routine. And during all this, as I mentioned, a relaxation or mindful practice is important because stress increases the responsiveness of all these hormones. And this mishmash of problems of one gland not listening to the brain and the brain not listening to anybody else. So mindful practice is very important, especially because stress can release more insulin and we don't need that. So as I usually talk about, low glycemic index, maybe a whole food, mostly plant-based diet, exercise at least 3 to 5 days a week, cardio or resistance or a combination of both, mindful practice at least twice a day. I think all those are important. And you might have to get a coach to teach you the nutrition, to teach you the mindful practice, and to help you exercise without injury. But that's why we have insurance. If you don't have insurance, then you kind of beg, borrow, and steal from your family members. But that is the projection, or at least the direction I have with anybody that is even walking into a PCOS kind of deal. Or if you're not PCOS yet, just have a little bit of facial hair, a little bit of irregular period, and you're young, it would be important to start to treat yourself like you're PCOS now. And again, the treatment is essentially what we all do for cancer, high blood pressure, cholesterol anyway, right? So you don't have any harm by doing it. As far as how deep you jump into the lifestyle change, that's totally up to you. I think everybody should do it, but we all have our limitations. So, Anna, good question. Hopefully this gives you a little bit of clarity as far as where we're going. Don't be discouraged, and again, take advantage of what insurance covers. Come back and let me know about how we can adjust it, and hopefully we'll get you to control every disease process coming up.